Hello, everybody, and welcome back to a brand new episode of the Veramed Stories podcast. I'm your host, Himesh. In this week's episode, we are talking about changing careers and joining the GTP. So joining me this week is Matt Burgess. Matt, welcome to the podcast.
Hi, Himesh. Hi, everyone.
As the title suggests, we're talking about changing careers, or career paths even, during the GTP. So why don't you start by telling us what you studied at uni and what happened after you finished university?
Yes, so I studied biology at undergrad at Durham. Always had quite an interest in the natural world, so kind of leant towards that. Then while I was doing that degree, I did a placement year working in a lab, which is actually a preclinical testing company, sort of testing drugs on like human samples to see if there was like allergic responses and things like that. So it was quite interesting, like the science behind it, but then I didn't really think the actual lab work itself was for me. So I was sort of looking for other things that were related to my degree, but yeah, kind of involving the biology, but not in that way. And then I kind of stumbled across the world of clinical trials after university. I found a university unit, so academic-led unit, where there was a role of they called it a clinical trial facilitator there, which is sort of helping out with the admin involved because they're kind of using paper records for a lot of things. So there's a huge amount of admin. And yeah, that's how I ended up there. Worked there. I got promoted to the role of a coordinator, which is kind of equivalent to a CRA, clinical research associate. I can tell you a bit more about that role in a bit, but I worked there for about 3 years and became more interested in stats when I was there, and ended up doing it's called a graduate certificate, and in the evenings alongside working there to kind of test the waters a bit before taking the plunge into doing a full-time master's. But then I enjoyed that course a lot, so did do the master's, and then that was through 2020, 2021, and then came across Veramed, thought it looked great, applied, and then here I am almost 18 months later.
Excellent. Yeah, so there's a lot to unpack there. So what was it about the sort of the lab work that wasn't really for you?
I think the main thing was that when I arrived there, I was given some kind of reading to brush up on my knowledge on what they were doing there, and it was from like 20 years before, and it didn't feel like, although it was like a very interesting concept behind it, it felt like I'd be doing the same thing day in, day out, and there's quite a lot of like doing sort of repeated blood work, and I was kind of after a bit more variety, I think, from a role. Whereas I think sort of in that industry, you tend to work on one thing for like most of your career. But I've kind of had quite a wide range of interests, so it was kind of after something where I could move between things a bit more.
I see. So after that, we better go a bit more into your role and your promotion.
Yeah, so the unit I was working for is slightly different to kind of the setup for a CRO, in that in an academic-led unit, it's kind of typically a professor at university. So, for example, mine, there were a couple who were kind of in charge of the department, and they specialised in lung and breast cancer. So most of my time there was working on a couple of breast cancer trials. But yes, with the coordinator role, that was doing everything from going to, so the unit itself was kind of specializing in quite rare cancers. So in order to get the number of patients required for the trial, they were open internationally and across a lot of UK sites, like hospitals. So quite a major part of the role was going to those sites and hospitals to do monitoring there. So like data monitoring, checking the patient records against the CRF, checking pharmacy records for temperature deviations, and like whether they had enough stock to be treating the patients, and kind of just making sure that the trials all ran smoothly. So, making sure that, the drug was at the site before the patient came for their visit, and if anything went wrong, trying to resolve that, and then helping with if there were queries from staff about the trial protocol, we kind of handle them. It's like coordinating all the sites and helping them run the trial.
Okay. And did that role sort of overlap with the lockdowns, or had you already started your master's by then?
No, actually, I knew that I was going to be doing the masters starting September 2020. So I was going to take a kind of half gap year off starting in March 2020, but that's slightly unfortunate timing. So I carried on with that job for 6 months, but yeah, there was quite a lot of changes we had to make, and lots of amendments to protocols, given patients weren't as readily able to access the hospitals to collect their medication and things, so we had to get that sent home, etc.
Yeah, so it's kind of all hands on deck to kind of deal with this whole new normal at the time. And yeah, because I suppose, like you said, you had a lot of international sites and stuff like that. So coordinating, sending all the drugs to all the different countries must have been pretty difficult, considering everyone had different rules at the time as well.
Yeah, exactly. Yeah, there wasn't like a kind of blanket policy where we just implement that, and you'd have to wait and see what was happening in different countries.
So I bet you were quite glad to start your masters later on that year.
Yeah.
So how did you find that, doing your masters over the lockdown?
I quite enjoyed the remote working. I think doing a course like that was probably one of the best things to be doing in that time, because you're pretty free from any distractions, so you kind of get your head down because not what else was going on. Also because being a master's in medical stats, it was like extremely pertinent, and you end up kind of getting asked a lot of questions by friends and family about things they've seen in the news, or like whether that actually means anything, like the figures that are being thrown around. So I think it was like as good as it possibly could have been, really, in that time.
No, that's really good to hear. How did you find joining the graduate training program? Like, because you're already like been working for a few years, and you were, if you don't mind me saying, slightly older than some of the fresh grads. How was that? Did you find it a bit awkward at all, or was it just get on with it? Everyone's on the same page.
Yeah, I don't think I'd thought about it that much beforehand. Again, most people come in when if the program are kind of straight from undergrad quite often, and then statistician like a year after that. So it's sort of 3 or 4 years older than most. Yeah, I hadn't really thought about it. Yeah, everyone was very friendly joining. Didn't really feel like too much of an age gap, although having like had sort of an office role before, whereas a lot of people were kind of starting out and getting used to the schedule of things. But yeah, it's a very, very welcoming place.
Yeah, that's fair enough, because I had almost similar experience to you, where I was working in a completely different industry, to be honest, for a few years. And then I came into programming on the GDP of part of a different CRO. So I was slightly older than some of the other graduates, but it didn't really matter because we were all learning SAS and everything from scratch anyway. So it was quite good. And I didn't have anything to unlearn, so I was almost at an advantage there. And being slightly older, like you kind of know what an office environment's like and that kind of stuff. So yeah, it was all good. And I'm glad you had the same kind of experience as well. So did you find your background helped like with some of the, like just learning this industry and like statistics and programming in sort of like CDISC and just clinical trials in general?
Yeah, I think what it's actually helped with a lot is all the acronyms and initialisms that get thrown around so much, because it's basically all of clinical trials is in acronyms. So I suppose it's like not having to look things up as much, kind of knowing the structure of the trial a bit more. Like, so in my previous role, we'd done interim analyses, and I'd kind of sat on an independent data monitoring committee, like doing the minutes and coordinating those. So I was kind of aware of like what their role was within trials. So it's kind of, I suppose, the sort of checkpoints in the trial I was quite familiar with. And then quite a lot of the role before was working on like ethics and regulatory submissions. So kind of, yeah, like a lot of contextual knowledge. I think also recently I've been able to do some SAP writing, and kind of having the biology background, I think it's quite useful for that. And then like with helping with the writing as well, rather than kind of just having just pure programming knowledge, sort of there's that on top of it as well.
Yeah, because you mentioned that you were having to read protocols and things like that in your previous job. So none of this was new when you look at all these documents and stuff. So, and you almost had the advantage of you've already peeked behind the curtain. Do you know what I mean? Like you've seen how all the trials work and coordination and stuff like that. So you probably had a bit more appreciation for that than people who haven't seen the other side of it. Yeah, excellent. Is there any advice you'd give to anyone that's kind of like thinking of moving to this industry, or whether it like similar to you, where they're kind of already in this industry but would like to go into a bit more stats and programming? Is there any sort of advice you'd give, or any sort of things that you know now that you wish you knew then?
I think, well, advice for people coming into the industry, or what I wish I'd known, is that you don't have to like find the perfect job straight away. It's good to try things. So I think after university, there's quite a lot of pressure on thinking, oh right, I'm going to have this job forever. But like if you think you like the field of interest, then it's good to get into something, and then maybe that role itself might not be perfect, but it opens your eyes to a lot of other things that go on in there. Like I didn't even know that the clinical trial industry, like really like how it worked. I just thought sort of like hospitals got sent some drug and they were given to some patients, and then that was like recorded, but I didn't really realize kind of the operations behind it, and like all the effort that goes into the analysis. And so yeah, don't worry too much and give it a go, kind of.
Yeah, no, I think I echo the same advice, because I think a lot of people in the early 20s, especially straight after uni, like you said, are a bit lost, not sure quite what they want to do and things like this, because you pick your degree you want to do when you're quite young. So by the time you finish uni, or you finish your master's, or like your PhD or whatever, you might not have the same interest anymore. So yeah, don't be afraid to move around. Like you're still young, you've got all the time in the world, and you're going to be doing this job or be in this industry until you retire. So if you don't like it now, you're not going to love it then. So feel free to move around, do all that kind of stuff. Excellent. So do you have any other like comments for any of our listeners?
Yeah, when I first did stats, I absolutely hated it. I did it at uni. When I was my biology course, the first 5 or 6 lectures were just pure stats, and then after that we didn't cover it at all. So it was sort of like, here's all this stuff to do your analysis on your research. And then when it came around to it, you'd sort of write your report up, and then you'd get to the analysis section and be like, oh no, got to do this stats stuff that no one really understood. Whereas I think if it had been taught in a bit more of an applied way, like as we were working along in like our practicals, like within specific areas, so you can see how it's applied and why it's useful, that would have been like really good for me. But then I suppose if most people are coming onto the grad scheme from a stats master's, they probably quite like stats. So that, yeah, probably applies a bit more to people who might be thinking about changing. But yeah, there's such a like diverse range of things you can work on with it, which is part of the reason, like my main reason for wanting to work for CRO, which is to have that variety. And yes, since coming here, I started in oncology and then moved over to respiratory, and so I've already covered like 2 therapeutic areas, and yeah, there's been lots of variety.
You cover a lot in the 18 months that you've been here. Like for me personally, I didn't realize how much I learned until the next batch of graduates joined, and they ask you a question. You're like, oh, I know that. And you just slowly absorb information like every day. And by the end of it, you're just very well versed in all of this. So excellent. Right, Matt, thank you very much for joining me on the podcast and sharing your story. I'm sure many people listening will find it very useful, as I'm sure there's other people kind of on the fence of whether they should take the plunge or not. And from what you said, do it.
Yeah,
just give it a go and see how it goes. Excellent. Thank you all very much for listening. If you'd like to be notified for any future episodes, please subscribe to us on Spotify, iTunes, or whichever podcast platform you're using. If you'd like to know more about Veramed, please visit our website at veramed.co.uk, or you can find us on LinkedIn. If you have any questions about Veramed, please feel free to reach out to me on LinkedIn. I'm always happy to help. You can also find us on YouTube and Instagram at We Are Veramed. Thank you all very much for listening, and until next time, goodbye.